Hello, doctors, students of homeopathy, and friends of homeopathy. Today is the 1760th day of uninterrupted daily webinar of International Forum for Promoting Homeopathy. And today our guest is Professor Dr. Muktinder Singh, a very famous classical homeopath, adept in dealing with pediatric cases and behavioral disorders, autoimmune disorders, and advanced pathologies. He do have a clinical experience of 27 years and also a teaching experience of more than 24 years, working as professor and head of the Department of Repertory at Sri Guru Nanak Dev Homeopathic Medical College and Hospital, Ludhiana. He is the PGK for MD postgraduate at Guru Ravidas Ayurvedic University, Hoshiarpur. He is a guest faculty at London College of Homeopathy, UK, and he is a physician at Homeotouch, Ludhiana. Our topic of today's discussion is painting homeopathic perspective. Let me welcome Dr. Muktinder Singh for the session, and I welcome you all for the session.
Good evening. I'll just share my screen. Right. So, hello friends. First of all, my regards to IFPH for inviting me on this platform. Myself, Dr. Muktinder Singh. I'm the part of repertory faculty of my institute. So I have been practicing since almost 35 years into homeopathy practice and in education as well. And my practice has taught me a lot because our real teachers are our patients. So whenever there is a patient which make you to think out of box, it just gives you insight into certain things. So as you can see the video, this is a very common stance we see into our clinical practice, that people suddenly faint. So, and sometimes people in the history give us such an information that there were instances when they fainted down. So what does it mean into our medical language? The first an introduction. So see this video first. My video is visible? Hello, doctor?
Yes, sir. Yes, sir.
Sometimes this is taken as some funny instances. In most of the instances, people or persons would laugh at it. But this actually is not a very good condition because it can cause a lot of injuries. And this loss of consciousness while driving or while doing something important, you might get hurt very badly. So in homeopathic literature, it has been mentioned as a syphilitic train because all your conscious, all your balance of the body, all your because when it comes to the conscious level, so whenever you lose your conscious, control over the body is also lost. So in this video, we have seen that there are different instances. This has been taken from YouTube. So this, I just wanted to show you a idea of what we are dealing with today. So as I told myself, Dr. Muktinder Singh, this is my contact information. So what is syncope? The actual word used for this sudden loss of consciousness is syncope. As you can see on the screen, the right pronunciation is syncope. So, and these days, as we are talking about inclusion of homeopathy into the insurance sector, that patient should get the claim. So when we talk of insurance sector or the modern classification of disease, this is called International Classification of Disease, Manual 10. So the diagnosis for syncope or collapse is R55. So when you write this diagnosis, only then the bill can be claimed. So there are protocol, there are diagnostic criteria, there are differential diagnosis. So as we are growing into a medical fraternity, so every homeopath should just go into the surf the internet and should have a fair knowledge of this ICD classification. So otherwise, in our language, we can call it fainting or syncope or dizziness, but there are certain specifications for this diagnostic criteria. So when you write R55, then this is a billable problem. And if you present a case, you should know that what you are dealing with. So it's medical language. It is not neither called syncope, nor called collapse, nor called vertigo. It is called R55. So it is brought on by brief reduction in blood supply to the brain. What happens is when someone is standing in the sun for long, when someone has been exposure to long exposure or sudden anxiety, or due to standing in the sun or standing for the long period or standing from sitting posture or from lying posture, the brain doesn't get the adequate oxygen and blood supply. So there is a sudden fall in the blood pressure, which causes this sudden failure of our system. So if the blood pressure suddenly drops, your heart rate slows down, or amount of blood in different part of the body fluctuates. You could experience a syncope. So whenever the different blood pressure in different part of the body fluctuates, you suddenly get a sudden total shutdown of your system. So syncope is basically a transient loss of consciousness due to cerebral blood loss. So syncope mostly is 3% of men and women. Why? But if you call it when 75%, the age crosses the 75 years, then there are more patients. In young patients, less than 75 years patients, it is 3%. While in more than 75%, the incidence simply doubles down. So now what is different type of syncope? The first of all is called vasovagal syncope. So what happens is when the vagus nerve, which causes the coordination between brain and body, what we call our system is autonomic nervous system, which we call commonly called sympathetic and parasympathetic nervous system. So there is sudden reaction, which is beyond our control. One is voluntary, and in common language, I'll say one is voluntary nervous system and one is involuntary, as our heart rate, our respiratory rate, our bargogmy or our intestinal movements, stomach. All these are controlled by the part of nervous system which is beyond our control. While this motor nervous system, this is in our control, that we can move our hand with our will, but we cannot move our stomach or heart and increase or decrease the heart rate. It is by the other nervous system. So it is mostly cardio-neurogenic. So vasovagal syncope, also known as the cardio-neurogenic. I remember one of the patients, she was brought to me and she was suffering for last more than 10 years. And even no doctor could diagnose. She was she was either being treated for antidepressants with, or she was given the neurogenic drugs, but no one was able to diagnose. I was even later on, their family doctor, she called me, doctor, you have made a right diagnosis. So the right diagnosis for that lady was vasovagal syncope. What is that vasovagal attack? There are certain patients into our life to suddenly get their anxiety get triggered and they get hyperventilation and that out of control and suddenly they faint. So this is a panic situation. That lady was hospitalized for more than 50 times. Every time she was fainted, she was brought to hospital in emergency and they keep her for 1 hour, 2 hour, 3 hour, and when she gains consciousness, she was dead. But she was not diagnosed. But later on, when I tried to decode, because we homeopaths, we take mental history, there was no mental stress. We take that otherwise other anxiety patterns. She was otherwise a very responsible and handling her home very well, that kind of lady. But suddenly, whenever there's something triggered her, she just faints. So this neurogenic, cardio means heart, neuro means neurosystem. It is the most common type of syncope in which the blood supply to the brain is reduced as a result of abrupt reduction in the blood pressure. So there is abrupt reduction, more than 10 in a go. Gravity causes blood to get collected in the lower part of the body, that is below the diaphragm when you stand up. So when your blood is more below the diaphragm than above the diaphragm, we know that when the heart pumps the blood, it comes back with its own pressure, and our lower limb nerve veins, they have the valves, they push the blood up. Once the blood which has gone up will not go down. But when our total blood is more below the diaphragm and less above the diaphragm, so brain will not get the sufficient blood supply. So during this condition, your autonomic nervous system and heart cooperate to maintain a constant blood pressure. But while vasovagal syncope usually causes, it is called orthostatic hypotension. Ortho means position of the body. Statin means static means the lower in the motion, and hypotension means sudden loss of blood pressure. So this condition keeps the blood vessel from getting smaller, because whenever there's a, though they should, when the patient stand. So when the patient stand, the blood, the vessel should constrict so that the blood is maintained above the head. This causes pooling of blood in the legs. As a result of blood pressure quickly drops. So when this blood goes down with the gravity rather than giving adequate supply to the brain, then there is a sudden cut down of the blood supply, and which the brain takes as the alarming sign and it suddenly shuts down itself. So there are different type of syncopes. One is situational syncope. There is one of the type of vasovagal syncope. It occurs under specific conditions that have an impact on the neurological system. So when this neurological system, because our neurologicals are brain, blood barrier, our brain, and we know the chloride gates when potassium and sodium exchange, ionic exchange. So whenever there is a dehydration, that will cause sudden loss of consciousness if the patient is sensitive. We'll go to the materia medica, heavy emotional strain. Whenever someone is having very much, we see that sometimes patients, they faint in extreme stress, anxiety, fear, pain, or hunger. So whenever someone is hungry, has not taken adequate food or adequate water, and due to some anxious conditions or due to some fear, sudden loss of blood pressure to the brain, and then it causes the syncope. Then certain drugs or alcohol, sometimes people faint after taking some drugs or alcohol. Hyperventilation, as I told, when you take short breaths with long accelerated breaths and short breath, this is called hyperventilation. When we are ventilating more frequently, wearing tight collar, as we know, sometimes we just limit our knowledge to the Lexis only, that if a tight collar is causing a problem, only Lexis is the problem. But no, this can cause, because neck area has the passage of so many arteries, so many veins, so many nerves. So any tight pressure can cause the external pressure, and pressure might cause the drop in blood pressure to the brain. Wearing tight collar. So, and sometimes there's a situational syncope called micturition syncope. When someone is passing urine, due to that, for standing for some time, and then passing of urine sometimes dehydrates you and you suddenly get that kind of thing. Then is postural syncope. as the name indicates, that postural tachycardia and postural hypotension. This is also bad. So when someone is lying down and suddenly gets up. So when sudden drop in blood pressure due to quick change in the position, such as from lying to standing, this causes the postural syncope. This condition can be caused by certain medications and dehydration. When patient with this type of syncope stands, their blood pressure usually drop by at least 20 Hg. Say someone is having 100 by 60 blood pressure, and if it drops by 80 to 40, so that brain will not get the blood supply. The condition in which the blood flows to the brain gets affected, which can cause a rise of syncope named cardiac syncope. So then this heart is not able to cope up, so which causes obstruction in the blood flow in the heart due to some structural heart disease and blockage in the cardiac blood vessel. So as we see, whenever someone gets heart stroke or stroke, so there is sudden loss of temperature, the veins and the arteries of the heart, they constrict and they affect the functioning of heart, pumping of the heart. So when the pumping capacity is less, the people with low LVEF, they are more prone to get this kind of syncope, cardiac syncope. Then neurological syncope, a neurological condition such as seizures, stroke, or transient ischemic attack, which just I was causing. So that sudden causes a panic button into our system. And in migraine and normal pressure, hydrocephalus are two less common causes of neurological. For migraine, and sometimes some people faint in the migraine, or while there is hydrocephalus. So the brain is under pressure, as in glaucoma or some visual disturbances. Then what are the common causes of syncope? First of all, we should rule out any underlying cause, any systemic cause, means some brain pathology, some heart pathology, heart attack, or there are sudden. So the nervous system or cardiac system deficiencies or some underlying general conditions, or of a person can cause occurrence of syncope in them. An underlying condition that affect blood flow through the body, say aneurysm or some embolism or something like that, can also affect when you change position. So what are the common symptoms of syncope? When a person, to diagnose syncope, you should have at least few of these into the list. One is when the person is suddenly feeling nauseated. As I say, usually patients they say मुझे कुछ हो रहा है, एक तो मेरे को कुछ हो रहा है, मेरे को कुछ हो रहा है. Heart palpitations means your heartbeat, arrhythmias are there, and you feel light at the head, lightheadedness, and blacking out. Suddenly there's loss of vision, you cannot see, falling for no reason, dizziness, drowsiness. So don't just think of gelsemium. It can be the medical condition. Fainting, especially after eating or exercise. Someone is into the gym and they have sweated a lot, they have done exercise, and suddenly their heart has not yet settled down and they change the posture, unsteady or weak standing, and changes in the vision, sometimes tunnel vision or seeing the spots, and headaches. So these are the common symptoms. The person said sudden headache, nauseated, I'm unable to cope up, a blackout ho gaya. All these symptoms, they are of the syncope. So what are the differential diagnoses? Now, we know that a person in the vertigo can say the same thing. A person in the dizziness can say something, or syncope. So how the syncope is different from vertigo? Because vertigo we usually, because in Hindi, sometimes person will call, मुझे चक्कर आ गया. So when someone falls, कहते हैं, ये चक्कर खा के गिर गया. But vertigo is a different condition. Syncope is a different condition. Vertigo doesn't necessarily mean that you will fall. You will lose the consciousness. Sometimes you get vertigo on and on for days and all the time when you get up, but you don't lose the consciousness. So to qualify the definition of syncope, one must lose the consciousness. So if you have vertigo, you may experience spinning sensation, घूम रहा है. Vertigo has an effect on balance, but is not uncommon for someone suffering from vertigo or suffer from nausea or vomiting. So we are talking that nausea, vomiting might occur. So even with the vertigo patient, it can occur. But someone suffering vertigo or is having these symptoms but being conscious. So most cases of vertigo are caused by condition affecting your vestibular system. You know what is vestibular system is? In our ear, we have vestibular apparatus. So vestibule, there is a fluid into the brain, there is a fluid into our ears. So when that imbalance occur, when there is a pressure in the right, you might have sometime feel while you are traveling into the hills, up hills, as in Cocculus we see, or when you are just taking that giant wheel. So suddenly you get that kind of imbalance of your vestibular system. And some people, they get severe imbalance. They cannot stand and sometimes they faint. So that is vestibular system affection. So it is located into our inner ear. Your vestibular system assists your brain in receiving information about your movement, positioning, and location in space. So this vestibular system has this proprioceptive sense and vestibular sense. These days in autistic kids, we work on these. So these are the two senses, sense of balance and sense of space. What is around me, whether I would be able to jump up this much of the distance, or I would be able to descend that step or ascend that height, or whenever you are driving, so you have a judgment that I would be able to pass through that narrow place, or how much speed is from the vehicle coming from the other side. Would I be able to take over that? So all these are vestibular and vestibular sense, vestibular and proprioceptive sense. So in vertigo, the major cause is imbalance in your vestibular sense. While in syncope, the reason is loss of blood pressure, loss of blood supply to the brain. In our ancient literature, we get anemia of brain. If you get these classical repertories, you'll get this symptom as anemia of brain. When your brain is not getting adequate blood, so they call it anemia of brain. Sometimes I remember our teacher, when I was appearing into the exams, he asked me, what is the difference between anemia of blood and anemia of brain? At that time, I took some time to understand. Anemia of brain, as usually anemia is a condition of blood. But into our literature, you see anemia of brain. What does it mean? Means blood supply, brain is not getting sufficient oxygen, sufficient blood, so that it causes a sudden situation like anemia. And vertigo, I was differentiate between vertigo and syncope. So vertigo is frequently triggered by change in head position. So there is only, it is not the body position. As I saw that this situational or the postural syncope is caused by change in body position. Why? Say vertigo is a common symptom of cervical spondylitis also. So when you move your head and it is spinning, then it is vertigo. But when you are rising from bed, your head is going against gravity and you lose the consciousness and you feel nauseated, that is syncope. I hope I'm clear. Hello, can someone say me in chat? Please type. Am I clear? Someone has called that there is no audio. Yes.
Yes, audio is there.
Yes. Right. So I'm clear in what I'm trying to make you understand. There is a difference between syncope and vertigo. So common symptoms, causes of vertigo, as we have called common causes of syncope. So same common causes of vertigo are benign paroxysmal positional vertigo. So positional vertigo, as we see in the conium, by closing the eye, by changing the position of the body, the conium, they'll get the vertigo, not the syncope. Conium is not a strong remedy for syncope. While cocculus, nux moscata, and this veratrum album, and these remedies, I'll go to the materia medica part. These are the common remedies for the syncope. So Meniere's disease, you all know, that is a kind of tinnitus and loss of balance. Vestibular neuritis, as I told you, that vestibular apparatus, there is an inflammation or there is a neuritis in that. Labyrinthitis, labyrinth is also a part of inner ear. Then vestibular migraine, migraine with imbalance, cerebral, Bell's stroke, head injuries, tumors that affect the CNS, central nervous system or inner ear, multiple sclerosis, and certain type of medication, they cause the vertigo. There's a very common side effect of many of allopathic drugs that they can cause the vertigo. So these are the common causes of vertigo in contrast to the syncope. In syncope, there are systemic diseases either or the positional situation or neurogenic, cardiogenic kind of syncope. Then common symptom of vertigo, as we see in common symptoms of syncope, there was vertigo, blank out, but here that is spinning sensation, घूम रहा है, कमरा घूम रहा है, सिर घूम रहा है, चकरा रहा है. Then tilting sensation, as if I'm falling, I'm tilting down. Then swaying, I am as if मैं झूम रहा हूँ. As जब आप छोटे बच्चे को कई बार आप बोलते हो कि sometime if it turns around wrong or merry-go-round or some rounding kind of the swing, and then they stand, so they are unable to balance, unbalanced, pulled up to one direction. Other symptoms that may accompany vertigo include nauseated. Now, this is a common. In syncope also you might feel nauseated. In vertigo also you can feel vertigo. So nauseated, vertigo, vomiting, jerking eye movements. Now, this nystagmus, your eyes are oscillating eyes. Your usually your black part of your eye is stable. But when it starts oscillating, when you have the imbalance, headaches, sweating, ringing in the ears, all these are the symptoms of vertigo. Now, there is a third position which is called dizziness, as we call in the Gelsemium nux moscata. That person is unable to get up. Unable to get up, that is dizziness. So one of the most common reason adult visit their doctor is dizziness. So, but the person, the patient will say to all situation, doctor साहब मेरा सर चकरा रहा है, मेरे से उठा नहीं जा रहा. In all the three conditions. But and out of these three conditions, syncope is the most severest form. It will cause the panic button. Everyone, supposing you are going into the train or at some common place, someone just loses the consciousness and fall down. So it is a panic situation. While vertigo and dizziness is a kind of indoor situation. You will not get sudden dizziness. Sometimes you get sudden vertigo if you have underlying condition, but dizziness is usually in fever or in certain. So you, since morning, you are feeling dizziness. So it is more slow. It's severe to it is vertigo, and most severest is syncope. So frequent dizzy spells or constant dizziness can have a negative impact on your life. Means your performance goes down, your senses goes dull. You don't feel like working. You cannot perform up to your capacity. That is the dizziness. So dizziness rarely indicates a life-threatening condition, while syncope is a life-threatening condition. So dizziness is a general term for feeling unbalanced. Moving can be difficult when you are dizzy. So in dizzy, it's unable to get up from bed, unable to walk, unable to stand, unable. It is not the not possible, means sudden incapacity, but you just drag yourself, you just pull yourself, you just put extra effort in doing that. So as if you are about to fall. The common causes of dizziness, combination input from the various part of your sensory system determine the sense of balance. So eyes assist you in determining when your body is in space, how it is moving. Sensory nerves transmit information about body movement and position to the brain. Inner ear contains sensor that detect. So it is more of the sensory failure. So dizziness can occur for a variety of reasons like dehydration, heat exhaustion. These days, this sunstroke can cause syncope, can cause dizziness. So heat exhaustion, low blood sugar levels. Now hypoglycemia is another very strong factor because your body is not getting sufficient the energy levels because of low blood sugar. Iron deficiency anemia, low blood pressure, anxiety, motion sickness, head injuries. So these are the common causes of this dizziness. So taking certain type of medications, alcohol consumption, carbon monoxide position. So common symptom are a distorted sense of motion or spinning. Means you are unable to get that sense of motion, fainting or lightheadedness. You feel your head is gone empty. Uncertainty or loss of balance, sense of floating, wooziness or heaviness. So as if you are floating, you are flying into the air, walking, sensation, standing up or moving your head may trigger, exacerbate these feelings. So dizziness may be accompanied by nausea or may be sudden and severe enough for that. You must sit or lie down. So episode could last second or days. Now, in homeopathic literature, so in Alan, so now coming to the homeopathic perspective of this was diagnostic part. And in part of anamnesis, diagnosis, we are homeopath must be excellent in diagnosing. Once you diagnose your case well, half of your work is just half of your work is although allopaths stop at diagnosis and they start doing therapeutic solutions or some management part of the therapy, which is very important for us as well. Some people they say that giving the right remedy is everything. No, managing your patient according to the I'll give some of your insights into that also. That what are the management of dizziness, what is management of vertigo, what is management of syncope. So you should know the right management. What are the maneuver you can do when there is a syncope, when sudden loss of blood pressure is there. So in our literature, first I'll dwell into my own literature. So in the Allen's chronic miasm, chapter name, basic symptoms of SORA, the rubrics. So it's written they may have chills or chilly sensation, fainting spell, headache, nausea, vomiting, and host of symptom follow attack of fear, even to convulsion, epilepsy, and spasm. So these are the symptoms of SORA. So there is sudden flare up of SORA because there is no pathological condition, but this is a kind of SORA, pseudo SORA, which will cause the life-threatening situation. So chronic miasm, chapter name, nose and smell. There is written they have trouble with order of cooking, the smell of flowers, perfumes, paints, plants. They induce nausea, vomiting, loathing of food, or fainting, sickness of stomach. This is how we understand the miasms, so understanding origin. And I searched the word faint. So in JH chronic miasm, chapter name idiosyncrasy. This information I got, for instance, we may see it in caution, is extremely cautious, painfully so, or a patient may be oversensitive to the presence of odors, flowers, perfume, gases, light, noises, colors, birds, that is, they faint easily when roses or violets are brought into room. When they are ill, they cannot endure a bright light, sunlight. Now, this is beauty of homeopathy, that it goes so deep. Or certain artificial light as lamp light or electric light, certain shades or color are intolerant to them. So we should know the susceptibility and idiosyncrasy. If the time with sometime we'll have a detailed lecture on this. Now, fair understanding of susceptibility and idiosyncrasy gives you a lot of insight into the miasm of the person and your strategy and your selection of potency and selection of remedy. So in a chapter name, clonic miasm, hunger, desire, and aversion. So it is written that morbid hunger, unnatural hunger is a quite a symptom of SORA. Hunger at unnatural time during the 24 hours, hunger at 1 or 2 before eating, or hunger in the night after sleepiness, hunger immediately after eating. Now, this hunger and appetite are very important inside. These days, many people are not say all, but many people they just keep from over only mind and mind. But these symptoms, they are gem of the symptoms. So they all gone sensation before eating, hunger with great higher agar the hunger that is not satisfied by eating, sura, although faint if hunger is not soon satisfied, or extreme hunger with all gone. So there is a relation of fainting with hunger over here. Then in the chronic miasm, chapter name sexual sphere, the hemorrhage accompanied with the vertigos, fainting, and with pallor of the face, which is worse by rising from recumbent position, quite frequently too soon appearing every 2 or 3 weeks. They may not be painful, but are always exhausting. So this is hemorrhages of bright red causing fainting. So this, why I'm mentioning this, when we are studying the medicine, when we are repertorizing the case, when we are differentiating the remedies, all these hairline differences, they make our selection foolproof. So they become chlorotic, as we say, due to the death of many of red blood cells, which we have already seen was due to the specific action of this miasm, pseudosora. So not infrequently, the complexion become pale, assuming a yellow rashy hue, accompanied with starchy or watery liporia, palpitation of heart, faintness, and loss of vitality. So they have understood that as a pseudosora. And if you read this, flushing of face, vertigo, ringing in the ear, hoarseness, finally a true tubercular condition develop. So this pseudosora give rise to a tubercular condition. So many of these cases have mental symptom. My company already given sadness, gloomy, anxious. So this is a different discussion I just mentioned. So they here also with the diarrhea, the fainting, and in the psychosis. Earlier we said that in the chapter Sora. Now this is the chapter psychosis. So she complained of shooting pain in the ovaries and through the uterus, bearing down. So hormonal fainting is more of, so here what I understood is what was the role when it is due to dehydration, due to malnutrition, due to loss of blood, sudden loss of blood. This is soric kind of fainting. Why? If it is due to some underlying condition, some brain tumor, some pathology, or some kind of hormonal imbalance, then it is psychotic. When it is sudden and unproportionate and with the very frequent spells, making a person handicapped, then it is symptomatic. So fainting spell during the menses, much trouble with her heart, also in cardiac, cardiogenic, neurogenic, and this kind of thing. So if it is due to anxiety, it can be soric. But if it is due to hormonal imbalance, then this is psychotic. So these are the homeopathic remedies we undergo. So I'll just give you a case first, then I'll come back. So I once got, actually this was, she was my aunt, and they came to consult me because her wrist was not healing. A year after she got the injury on the wrist, she was although diabetic and in her 60s. So she was already from the local homeopath. She was taking Symphytum, Rupta, and other fracture healing therapeutic remedies. There was no result. While I was taking the case, my uncle told that when I was about to examine, I told them, show me your wrist. So the uncle told that, Doctor Saab, be careful, she might faint. So it was very strange for me that fracture, how it can faint. So when I tried to examine, she just fainted in my clinic. Seemed very anxious and hysterical. Her reaction to examination was unproportionate. After that, she started with very loud belching, and with the same time, she fainted and just gained the we put the water onto her face, sprinkled water, and just pressed her. I was just looking for the camphor. I just mild nitrosome and camphor or first aid. And when she got, and she was very loud belching, and this was her presentation. So when I worked this with the repertory, so for non-healing of fracture, faintness from the pain, loud eructation, and hysterical anxiety, the only remedy which came out to be was the asfoetida. So I was strange, but I applied this remedy. I went, gave them this remedy, and as for to my surprise, I told them, she just, so within 3 days, he said that now she is not fainting anymore. And within 3 weeks, the fracture which was not healing for a year healed within 3 weeks. So that is the beauty of homeopathy. So we hardly think of asafoetida for union of bones. Have you ever thought of, please let me know in the chat box, that have you ever thought of asafoetida for non-union of bone? How much of you have an experience? Please type. So, but with the right repertorial approach, please write me if you have any, if any of you have any experiences, or is it the first grade remedy which comes to your mind for non-healing of fractures? And if you see, it is 2 marks over there. So knowledge of disease, when we know what the fainting is, hunting for the right rubric, I hardly took any mind rubric into this. So this was fainting from pain is a general rubric. So these days we ignore the generalities chapter. While generality chapter is of great value, I'm thinking of making a series on only on generalities. So generalities is such a, as we already call that, physical, mental general is taken as the number one symptom. Yes, if it is available. But the second most important symptom are physical general. So this is a physical general, faintness from pain. Now here we have taken one is pathological symptom, non-healing of fracture. It is a pathological symptom, which is a syphilitic symptom indeed, because the healing of fracture is a natural process. When it is not occurring, it can be due to the malnutrition, but it would be very slow. But if it is not healing for a year, the fracture which should heal within a month is not healing in a year, means there is some pathology. So this is syphilitic. Now fainting is again here from pain. Anxiety hysterical is a syphilitic, and this causing loud eructation is again. So this is a frank syphilitic case for. And when I applied this knowledge and gave the S4 data, the result was marvelous, which was not happening for a year, happened in 3 weeks. After 3 weeks, the X-ray was normal and she was able to gain that and she never fainted after that. So S4 data has came up as a strong survivor for me. So foul, thin, acrid secretions. So asafoetida is one of the hysterical remedy. Boger says it magnifies her symptoms. If you see Moschus, if you see asafoetida, if you see these are the tarantula, veratrum, these are feigning sick remedies, even belladonna. So they magnify their symptom. जिसको हम हिंदी में बोलते हैं राई का पहाड़ बनाना. The small thing seems to be a drop of water seems to be the ocean. छोटी चीज को बड़ा करना magnifies her symptom. So asafoetida is one of the remedy which craves a sympathy. So she will just attention seeker, fickleness, fainting, hysteria, clutches throat. So no, I'm dying, that occipital ache, ambulation stool, eyelid stick to the ball, numb about eyes, ozina. So Boger always write very small information, but that information is gem of the information. I hope I'm getting you. If you are with me, please type so that I know that I'm able to communicate you. So think of such remedies, think of understanding these remedies, knowing these remedies. So these are the remedies which are gem of the remedies. So asafoetida, we know that common hing we use in the common hing we call it. It's used in abundance into cooking. So this hing is a kind of gum of some plants. So then when you get this kind of symptom, so it is if you see there is a pure hing into your room, you cannot sit in that room. It is such a strong smelling agent. So asafoetida is causeless fainting. If you see now in this case, there was no pain, even the thinking of pain caused the fainting. So it is a causeless fainting. Phatak says it is a causeless fainting. Fainting from pains, fainting due to sensitive hearing in crowded places, and along with fluttering of heart. If you is asafoetida has these symptoms, along with heart palpitation, with sensation of limbs shaking. So say patient will say, "Meri tange kaamp rahi, I have no strength." Death-like sensation, with hysteria, in closed crowded room. So there is a train. They have to ride the train and they'll faint. If they'll just these days AC, they cannot tolerate the closed car, claustrophobic, and they'll just faint. After emission, while during question, after intake of medicine, there is a smelling remedy, they'll faint. When disturbed, there is a slight disturbance will cause a lot of disturbance. I'll just I'm stopping the sharing. Just I'll add some information. Sir, how much time we are left with?
We are having about 5 more minutes.
5 more minutes.
Yeah, 10 more minutes because we need to interact. If we need to interact with the participants, only 5 more minutes to go.
So another remedy which so I'll just mention only few remedies here. So another remedy which I'm mentioning here is a very beautiful remedy. I hope you learned something new about this asafoetida today. So asafoetida is a great remedy for fainting people. When they just faint of no reason, or the hysterical ladies, the females who faint very easily. So fainting. So another remedy which I'm thinking to share with you today is because I'm left with the very less time. So I'll be just sharing you one of another rare but very important remedy. Yes. If you call up the Nux moscata, Nux moscata is a very important remedy. If I just search the rubrics, so faintness, hysterical, on excitement, menses during climacteric period, pain from diarrhea during pregnancy, during stool, during blood at sight of. So there are many people who just see blood. I remember one of the lady we were serving into the Gurdwara. So we usually on the service day, whenever they Gurpurab, we make langar, and that lady was they were cutting the the vegetables, washing and cleaning and cutting chopping the vegetables. So suddenly a lady fainted. So what happened is she said the the lady sitting next to her was cutting it with a knife, the chopping the vegetable, and got a slight cut on the hand. The lady which received that cut was unaware of it. He was just talking. It was a minor cut. There was a drop of blood. But the next lady sitting next to her, which hardly got injured, just saw her blood and fainted down. Or there's another incident that this lady, the parents called me that today we went for the blood examination. So when this person was taking the blood, so after taking the blood, there was a drop of on the cubital fossa, and she just saw that drop and fainted down. So whenever there is a blood at site of blood, this is a very important. There are 3-4 remedies: Staphylococcus, alumina, Nux moscata, and even aconite sometimes comes in. Then colic during intestinal, fainting, fainting transient, fainting in crowded room, fainting in loss of fluids from, fainting at night, fainting palpitation during, fainting standing in church during menses. So if there are menses and someone standing in church, then they faint. Weakness from afternoon, licoria with menses before, menses suppressed from, sleep. So where after fainting there is sleepiness, fainting and sleep. I'm taking just from. So Nux moscata fainting lady is Nux moscata is a great hormonal remedy. I have used it invariably. Sometimes the girls who take the pills to postpone, or as if there is a function or some puja at home, or there is a some kind of ceremony. So these days the girls, they take hormonal pills to await the date of menstruation or to postpone. Or sometime the lady, they take contraceptive pill, or after they got sudden pregnancies, accidental pregnancies, they take the pills to abort the child, or after abortion. Whenever there is a insult of your hormonal system, at that time, if you startly sudden get the symptoms of sleepiness, uneasiness, fainting or something, I always use the Nux moscata. So it is a as important remedy as Nux vomica. We know that Nux vomica is the major polygas, but to Nux moscata and Nux vomica, they belong to the same family. But Nux vomica has more of the nervous system. Nux vomica is also a remedy for fainting, as from brain fag, students who have been waking all night and in the morning at the time of paper exams, they just faint. The Nux vomica is the remedy for brain fag, but Nux moscata is the remedy of emotion. Nux vomica is more of practical remedy, more of right-sided remedy. Nux moscata is more of the left-sided remedy, means right brain dominant. So whenever emotions there, Nux vomica will have sensitivity to noise, sensitivity to the stimulus, and they will get stiff, while Nux moscata, they'll go just lax. So Nux moscata and Nux vomica are a great remedy. So Nux moscata fainting lady would be lids heavy, stiff, feel sick, uterus displayed, mouth and throat dry, sleepy, faint, abdomen enormously distended after a meal, pressure in back outward. During third month of pregnancy, so it is a remedy, as I was mentioning, miscarriage, or it is induced miscarriage or natural miscarriage. During third month of pregnancy, nausea, vomiting, was hysterical and nervous, turned deathly pale or faint or slightest excitement, was so faint in her these attack that she could hardly speak. Labor pain, pulse weak, spasmodic. So in herring guiding symptoms, these are the proving symptoms. See the uh, reliability of the source. Herring's guiding symptom is one of the greatest. It is the mother of Allen Keynotes, mother of Clark's dictionary, mother of many remedies. So if it is a fainting, these are the proving symptoms. Eclampsia, head jerked. So these are headaches. So I'm not going into the detail as time is alarming. Combined repertory, female abortion tendency, hysterical woman, faint chilly. So Nux modica is another remedy for dehydrated. Veratrum car, Veratrum album, and Nux moscata. These are the top remedies in cholera, fainting of cholera. Constipation from inactivity of bowels in women who are disposed to faint, who bolt their food, or oppression with debility, alternating with diarrhea, diarrhea with loss of appetite, great sleepiness, indomitable disposition to sleep, stool offensive, copious, aggravation at night. So these are the symptoms which give rise to uh, the symptoms of the kind of sudden syncope. So I think I should now give the time for the question answer. If you have, you just type, I'll answer. So Nux moscata, another keynote is tendency to fainting, allied to drowsiness, sudden loss of memory, vanishing of ideas. So the Nux moscata is a confused remedy. They'll just wake up and afternoon nap, they'll wake up and say it's early morning. They'll start doing brush and doing the morning course. Such a confounded remedy. Person who easily faint away from sight of blood, from standing, faintness during and after stool is great indication. Fainting fits, blindness when fainting, palpitation of heart, sometimes with attack of fainting, coldness and fainting with pains, especially headaches, faintness during or associated with evacuations, apes, pulsatilla, spigelia, veratrum, fainting with scanty stool, protontic, talcamara, petroleums. So I'm not having the time to differentiate these remedies. And here we compare it with the moscas. So I will just, because time is very short, kindly give me your questions. Someone has written that what was the potency of asphotica? I used it in 200. So 200 few doses. So what are your other questions? You can ask me. Otherwise, we call it a day.
Thank you, Doctor. It was an excellent session. Let me welcome Dr. Indranil to interact with you. Doctor, please unmute from your side.
Yeah, thank you, sir. The session was very nice, informative. You have unfolded it in a very simple language to us. Sir, can you guide us about the red flag signs in syncope, where a homeopath should immediately refer to a conventional center, because it happens many times. And sometimes we lose the patient of syncope also. Maybe our
Sir,
relatives.
actually, I have cut short my practice. There, basically, being a homeopath or an allopathy, because I told you that fainting is a transient thing. It is not the prolonged loss of consciousness. So for the diagnostic purpose, but we must refer it for the diagnostic means if there is some systemic disease for MRI or for neuro opinion or psycho opinion, we can send. But we should be sufficient enough because this is a kind of medical emergency. So being a homeopath, as we learn CPR, as we learn so many other art skills. So this skill should be at first hand with us. It is not that a person has fainted in front and will refer it. We are doctors. We should be
Yeah,
able to, so
yeah,
we
yes.
should be able to handle it instantly. But what we are talking in OPD setup, we either get the patient or we hardly get a patient who faints in front of us. So it is the tendency which we are treating, because at that time we just elevate the head, legs, and let the person die, or we ask the person to sit on the feet. So I
But,
will touch that part, but that is what our maneuver we can do. So it is a plot. But we as a homeopath should be sufficiently capable of handling the situation instantly.
Thank you, Doctor. Sir, I think we need another session on this itself, because a lot of things need to be added. We are having a lot to say, a lot to add on this subject itself. I am very sorry that the time is limited and we need to wind this session. And for the vote of thanks, I am just inviting Dr. Dhanish.
Thank you, Dr. Binduraj. Good evening, Professor Muktinder Singh, sir. It's really a very good session indeed. And we really got a lot of ideas how to proceed in those conditions of fainting and how to manage this with homeopathy and what are the other things to be done. As Dr. Binduraj pointed out, we need more discussion and some more part from you. Hope we can have a second part of the same in the coming edition of our session.
Yes, there are many remedies which I have not touched. That veratrum is one of the great remedy. Moscus is one of the great remedy. Cuprum is one of the great remedy which we can apply at first hand, and it gives excellent results.
Yes, sir. Thank you for coming over here and making such a wonderful presentation once again. And I am thanking those who attend the session on behalf of myself, as well as on behalf of the participants too. Once again, thanking Dr. Binduraj for such a beautiful moderation. Thank you all.